Today we are going to discuss an agent-based model designed for analyzing the impact of social distancing, shield high-risk individual, and informing context when someone shows symptoms of an infectious disease. This model developed in NetLogo allows users to simulate various scenarios to understand how these measures might influence the spread of illness in a population. So before our conversation, could you please introduce yourself?
Thank you, Mohsen. So my name's Jennifer Badham. I'm an assistant professor of social data science at Durham University in Northeast England.
So to start, can you please explain the main purpose of this model?
Sure. Okay, so the model came out of the COVID pandemic. The Northeast England region was a little out of sync with the rest of the UK, and a lot of the estimates that were of impact were being developed by the national government and sort of prorated to Northeast England didn't really apply. So the local government, who provide various support services, but also work with the NHS to provide hospital services, but also, ambulance services, general support for people, wanted to have a model that reflected the local conditions and that could also be used to investigate scenarios. So they weren't really looking for direct estimates, but they wanted to understand the impact on Northeast England of policies that were being taken at national government level. But it's very much a COVID model. So that's how it started. And the main thing that it's looking at is the impact on the hospital system, so admissions and occupied bed days.
What were the main challenges you faced in developing this model? Were there any specific difficulties in simulating symptom-based contact tracing, or high-risk shielding?
Yeah. Okay. So to understand that, you really sort of have to understand a little bit about the model. So in a sense, there are three layers to the model. So there's the epidemic spread layer, which is about agents, simulated people coming in contact with each other. On top of that, there's an epidemic progression, state progression process. But the policy layer, what we needed to do was look at all of the policies that were being proposed, because what we wanted to be able to do was say, if this policy happens, then here are some of the plausible futures. And so we had lots of different combinations. We had to be able to model policies by themselves, in combination, at various durations, and so on and so forth. The most complicated thing was making those work together in a sensible way. So we also allowed, for example, what proportion of people choose to self-isolate, or do they tell their recent contacts? We had within the population that protecting people who were at risk, so that they. But how effective is quarantine? Like how much do people breach it or whatever? But also making those things work together in a way that was coherent, so that you didn't have something like 90% of the population locked down, but 100% choosing to things that were sensible combinations could be modeled, but you could also model those policies separately. So the policy layer was the coordination in the policy layer was really quite difficult.
So Now, let's talk about the results. What are the main, insights coming out of the model analysis? Have any patterns emerged from running the different social distancing or shielding scenarios?
Yeah, there's nothing incredibly surprising. You know, the more policies that you have that each do a little bit to reduce COVID, the better the result in, you know, restricting the spread. I think, and everybody's familiar with that. You know, you have a greater lockdown, you have better self-isolation. You know, a greater proportion of people choose to self-isolate. You have more of your population effectively shielded. All of those will reduce the spread of an epidemic in, you know, intuitively obvious ways. The thing about the model was that more about comparing policy options, so helping the decision. It's very much a decision support model, helping decision makers to understand, for example, that lots of little policies might be better than one big policy, or to understand that, for example, during COVID, there was lots of discussion about getting, you know, reproduction ratio, the reproduction ratio to 1. Okay, well, that doesn't actually solve anything really. That's effectively a hold it in place status. And so if you get it to 1 and you hold it at 1 for a couple of months and then you release it again, well, it just takes off again. The epidemic just increases again. You haven't actually solved the problem. You haven't eliminated the epidemic. So by looking at different scenarios, the model was able to sort of help people, help the decision makers get an intuitive feel for what could happen under different policy outcomes. I basically developed a model semi-independently with my colleagues, with my co-authors, but not with the decision makers. But then we were working with the decision makers. Like, after presenting the model, we worked with them to sort of say, well, what sort of scenarios do you want to model? And initially they were just sort of saying, well, here's some questions that we would like to answer. And so we answered those and so on. And by the end of, we were using the model over a period of about 18 months. By the end of it, in fact, by about 12 months in, they were very engaged in not just saying, here's the question we want answered, but what the actual settings in the model should be to model the scenario they wanted to look at. And so another outcome of the model, if you like, wasn't so much an outcome of the result of the model, but a result of the process, was that the decision makers became deeply engaged with the model and changed the way they used it over the 18 months.
You have made your model available via comsas.net.
Yes.
What were the main challenges in making your model available to others using this platform? And how did you ensure it was well documented and easy to use?
So I put almost all my models on ComSys, so I've had some experience with it before. I haven't previously used the peer review process. I thought it was important in this case because COVID was a sort of a hot topic, if you like. But I document in a way that I kind of have the model users and the model reproducers as separate potential users of the model. So for example, I like the ODD protocol for helping me think through the things that I need to document, but I don't actually document with the ODD protocol. Okay, the documentation for users might, for example, have simple scenarios to help, you know, saying like a user manual or a teaching guide where you say, okay, just having the default settings, this is what's going to happen. Just changing one setting that is intuitively sensible, like introducing a a reduction in contact should reduce the spread of the epidemic, something that's, just one change, and then gradually build up to more complicated scenarios. Now, you can't really do that sort of thing within ODD. ODD is oriented to reproducing the whole model, covers everything, but it's not really for a user. It's really targeted at a future model builder. So I sort of I separated those processes a little. But I didn't really have any significant problems in putting it up on ComSys. As I say, I've used the platform before. I've got other models there. I'm using NetLogo, which is multi-platform software that lots of people are very familiar with. I have some documentation. I comment my code in a way that is intended to be about what that section of code does, not how it does it, and things like that. So.
Finally, what's next with this model? Are there any follow-up studies or model updates available or planned? To more explore social distancing strategies.
No, I don't. I don't have any. There's no future updates. It's finished. It's not being used anymore. I do have a further journal article to write about that participatory process. As I said, that the way that the users engaged with the model, they didn't use the model directly. I ran the scenarios and produced reports for them, but the way that they engaged with the model was quite a different process than normally happens in a modelling exercise. So I've got an article to write about that, but I don't plan to do any further work with the model itself.
Thank you very much for your discussion on this valuable model.
That's okay. Thank you very much for the interview.